Happy Monday. That was my friend back there. Those two boys there, Jeff, and who's this guy next to you? We had a good time with that lady next to you the other day, didn't we? No, not this lady, but when you got adjusted the other day, this lady that was next to me. You offered. I just talked to her today about that. Okay. Young lady, are you just by yourself? You are? You need to come and sit next to Becky there. Why don't you come sit next to Becky? She needs some friends. How many of you here never been to Gilead? By a show of hands. Wow, many of you. How about on this side? You two ladies been here before? You haven't. Okay, well, don't play around then. You're supposed to raise your hands way up. Unless you have a frozen shoulder, just bring your hands way up. Okay, that sounds good. A lot of you. Let me tell you a little bit about Gilead before we start. Is this music still going on here? It is. Can we just turn that off? Thank you. Oh, yeah, that's better. Oh, that's better. So many of you here has never been to Gilead, so let me just tell you a little bit about Gilead. We've been celebrating our 20th anniversary, and this was built back in 2004. And the purpose of Gilead is it's a healing center. So oftentimes people come to this place and they're like, "Is Gilead a church?" The answer is no. Gilead is a healing center, and in this place we have all the different access for healing, from massage to chiropractic to nutrition to holistic medical doctors to counselors to prayers to all of those things are, it's all happening under this roof. So people can just call in and they can ask for prayer if they choose to. And this place has been around since 2004. So we just had a big celebration there just a few weeks back. And so if you've never been here, welcome to Gilead. We're happy to have you. I don't know who dragged you in here tonight, but, that might be good, maybe not. How many of you here have been to one of our dinner before? So one person, 2, 3, 4. Okay, that's it. Everybody else are all new. That is good. That's good. So let me tell you a little bit about what we're going to be doing together. This is going to be fun, right? I mean, we'll feed you for sure. We don't know when, but we'll feed you. So I am the clinic director here at Gilead Healing Center since June of 2017. And we also have an office on the other side of town. So I don't see patient out of this place, but we have multiple doctors and nutritionists and, so on and so forth. And I started to do those dinners over 20 plus years ago. And the goal was to teach people a little bit more about health and wellness. So if you've been to some of our other classes, what we're going to be talking about tonight is, I only talk about that in here. So here we go. You're the lucky one. If you've been to other classes and you're like, "Oh, I've heard you speak, Dr. Jean-Guy, before," I'm like, well, good for you, but you're probably not going to hear the same thing. If you've been here, then it's probably going to be all the same. You might just get bored, but hopefully not. So how many of you here, I was telling Pat, before we started, I was thinking today, I was thinking about how many of you here remember who Patrick Swayze was, right? Because I was telling Pat, but she's behind there, and I said, well, this looks to be a young crowd. They might not even know who he is. But, Patrick Swayze, when he passed away, in case you don't know that, right, he was worth $40 million. That's a lot of money, right? I'm carrying this phone right here. And how many of you here remember who Steve Jobs was? Steve Jobs was the Apple man. And in the Ford magazine, they wrote an article, and they said that when Steve Jobs passed away, he was worth $7 billion. Would you agree that that's a lot of money? How many of you here tonight would be willing to trade places with him? None of you raised their hand, and that's good, right? Because the last class I did in my office, this lady's sitting on the back row. She's raising her hand. She's like, me. I'm like, he's dead. She's like, sorry, I wasn't paying attention. I said, okay, well, now you can pay attention, right? And I said, listen, would that be fair to say that if a person don't have their health, right, their ability to provide for themselves or their family would be affected? Would that be fair to say that? In the next 10, 15 years, whatever goals or dreams that you have, If you don't have your health, is it going to be easier or it's going to be harder to get there? Obviously. All those questions here tonight, they're going to be obvious. Just go along with me here for a minute, right? It's going to be harder for sure. And I always tell people, I'm like, that's the reason why we're here, is to protect your greatest asset, right? We're here to protect your greatest asset, which is your health. So in the next 30 minutes, maybe more, right? Just depending how much I have to tell you and how excited I get, right? It might be more than 30 minutes, but you will discover the most powerful, the most natural, the most effective way to be healthy and to stay healthy while minimizing the deadly effect of chronic illnesses like heart disease or cancer or diabetes, which is really devastating today for people. In case you don't know, I'll give you numbers soon, but it's truly devastating for this country, right? Unbeknown to people every day. If I was to ask by a show of hands right now to all of you here tonight, how many of you by a show of hands know somebody's been affected by heart disease? How many of you? Right? Keep your hands up. How many of you here know somebody's been affected by cancer? How many of you? Right? If you look around right now, I mean, unless you're not paying attention, you probably didn't raise your hand. But I mean, if you were paying attention to what I just said, it happened to everybody. So I always tell people that's the reason, right? That's the reason why we're here. Some of you here has been here before and you're like, hey, I've heard some of that. And I say to you, how am I applying this right now? If you have a piece of paper right now and you're like, okay, I'm gonna write some notes. Some of you are like, I don't want to write any notes, but let's just pretend you have a piece of paper in front of you. I want you to write this down. Are you ready? Just for those of you who are the good students here, write this down. Right? I want you to write down on the far left, you're going to write down information. And then in the middle, right next to it, you're going to write down action. And then on the far right, you're going to write down transformation. Obviously, those two here did not come in prepared, but that's okay. I'm not going to hold it against them. Right? So you have information, action, and transformation. And what I want to say to you tonight is this, is like, how many of you here has been to the gym before, right? Or you know somebody that goes to the gym and every time they go, you know that they're not doing a whole lot. Maybe they read the paper for an hour and then they go take a shower and then they leave. And then you have the other person, they're actually going to put their shorts on and then they're going to work out. Who do you think is going to get the most out of it in the next 90 days, A or B? Thank you. All right? I would like to be all of you here to be the B people, because the B people are usually the one that's going to get the most out of it. And my last question, which is not, well, it's probably not the last question, but if I say to you tonight, how many of you here, if I say who's responsible for your health, what would you say? Right? It's me. So here, if you have information, but yet you don't take any action, you're not going to see any transformation. Understood? So this working out thing, if you just read the paper, not a whole lot's going to happen. Unless you tell other people that you've been to the gym, but yet you didn't do a whole lot. You follow me? So here in the U.S. right now, if I say to you, do you think that in the United States of America, do you think that we have a healthy country? What would you say? No. Even when people know nothing about health, they always give me the answer. They're like, the answer is no. And why is that though? Right? If you were to give me some stats here, I'm going to give you a few of them. Did you know that 50% of our children right now in the United States of America, they're considered to be overweight? 50% of them. Did you know that last year or in 2022, which is, just a short 2 years ago, there's 53 million people that's been diagnosed with a mental health condition. 53 million people. Did you know that there's 25%, right, of women in this country after the age of 40 years old that they're going to take some kind of medication, their psychotropic medication for mind altering, right? That's going to change what's happening into your brain because supposedly, you either have fear, depression, anxiety. 1 out of 5 after the age of 40 years old. So my next question to you is like, why do you think that is? If we have the country that has the most money, we have the most knowledge, we have the best doctor, the best nurse, the best of everything, but yet our health sucks. Why is that? Here we go, right? Here's the food. That's why we're going to be putting bread on the table soon, and I'm going to watch just to see. I'm just teasing. And he's right, right? He's right for sure. What else? Air we breathe? Yeah, for sure. We all got a prescription medication instead of natural. Yes, medication. laziness in general. This guy here is not messing around. He's like, I'm just going to tell it just the way it is. And I always tell people, I'm like, listen, I said there's all of those, everything you guys said, the answer is yes. But there's two main things to me that, comes raised to the top is number one is taking responsibility for your health. Every time I ask the question, who's responsible for your health, people always tell me. However, oftentimes the decisions that we make are not lined up with what we say. For instance, we have symptoms, we go see the doctor, and the doctor is going to give you what? He's going to give you some kind of prescription to try to. We have a diagnosis, and then based on the diagnosis, we're going to give you a pill for it. And if it doesn't work, then we're just going to cut it. You see what I'm saying? So if I say to you that you're right in the middle of New York City, right, and you have a brand new map, but yet the map is from Michigan, even if the map is brand new, you still won't be able to make your way around. Would you agree? So having the right information is also important. Now with COVID, probably more than ever before, going through COVID since 2020, our people live in a confusion land. Of course, every single day people go on Dr. Google to get their information and thinking that this is the truth. But yet the vast majority of the time people don't know, right? Or they're not really sure what they got was the truth, especially as it relates to their health. If I say to you, every time that there's a car accident right here on Christ Road, the cops are always there, so therefore it must be the cops' fault. What would you say? There's a reason why I'm giving you some time. I want you to think about this because that's important. Right? People walk around every day and they're so numb, right? They just lost the ability to think. But if you don't think for yourself, then you're not going to know. When people say, well, Dr. Jean-Guy, you're just smart. I'm like, no, I'm not smart. We're just like, it's called common sense. That's what we want. Right? And I want you to be able to have that because when you walk out of here tonight, you're going to be by yourself. It's going to be you and you. And how can you make better decisions so you can get your health back? So none of those things are going to make sense unless I tell you the story because 25 years that I've been in this country now. And when I came here, people would always ask me, they're like, hey, you and your wife, you're pretty excited about what you do. And we are, right? There's 32 chiropractors in the family. I got 5 kids and I got 7 grandkids. My kids, 2 of them were born at home. They've never had drugs. They've never had nothing but a chiropractic adjustment and nutrition. People always ask, well, why is that? That must be just luck. I'm like, well, if you only have 1, that's luck. But when you have 5, it's not. Right? Do you understand that? So people are like, well, I want that. I'm like, well, you can have that if you want to, but then you have to be thinking differently. If you don't think differently and you make the same choices, then the outcome is going to be the same. Does that make sense? Yes or yes? The answer is yes. Right? You have to change the outcome. So I want to tell you a little bit of a story about me going back, right? I grew up on the farm. My parents were farmers. Their parents were farmers. And then when my mother married my dad, she was young. And then what happened is she's 17 years old. He's 22 at the time. And when she married him, she doesn't know that my father already has some health problem. So unbeknown to her, shortly after that, my father was, one day he's on the ground, right? And she thought he was dead. So she rushed him to the hospital. And by the time they got there, right, he's in a deep coma. And she doesn't know why. She thinks she's going to lose her husband. She's 17. And 48 hours later, when my dad came out of the hospital, by God's grace, they told him that he was a diabetic. And they're like, for the rest of your life, you're going to give yourself a shot of insulin, and you're going to do that at 6 a.m. in the morning. And then my dad did that at the age of 22. But every afternoon when his blood sugar would start dropping, then he would start eating bad stuff like cake, cookies, candies, ice cream, bread, rice, and pasta, just so he wouldn't pass out. And then my dad was also a smoker. He smoked 4 packs a day. So if you don't know what that is, he basically wake up in the morning, had a cigarette in his mouth, would have one all day until he hit the pillow at night. Did that every day from age 22 until he was 30 years old. And then what happened is by the time he was 30 years old, he developed this condition called peripheral neuropathy. Lots of people have it today. We're going to teach a class in January about peripheral neuropathy. But what happened to my dad is from his knees down, could not feel his legs. You could literally take a knife and just jab him in his legs, and he would start bleeding, and he did not even know what was happening to him. And then what happened is within 5 years, my dad was 3/4 blind. And the reason why I remember that clearly is because at the age of 35, right, at 3/4 blind, he would come in the bed, in the bedroom in the morning, 4:30 a.m., and he would say, son, it's time to get up. And I'd be like, well, what for? And he would say to me, he's like, listen, you're going to be driving the tractor. I'm going to tell you where to go because I can't see. And then in less than 1 year, my dad was completely blind. And by the time it happens, right, he got depressed because if you would have known my dad, he was a workaholic. I mean, he just loved to work. That's what he did. You're a farmer. You just work 20 plus hours a day, and that's what happened every day. So now he's like 36 years old, and he's blind, so he can't work anymore. Lost 40 pounds really quickly, got depressed. And then what happened is he was confined to the house. And by the time he was confined to the house, now he's like real skinny. He's in bed all day long, so he starts going from one side to the other. And when you don't manage your blood sugar properly, right, your optic nerve's going to die. You're going to be blind. The next thing that's going to happen is you're going to start having bed sores. And that's exactly what happened to my dad. He started to have bed sores. When they first started, they were about this big around. And then within 6 months, the bed sores was like this big around. And you could literally see every single layer of the flesh all the way down to the bone. And I remember that really clearly because at the age of like 8 years old, 7 years old, 9 years old, the doctor would come in and he would go right up the stairs, go right into the bedroom, and he would take this little piece of, tape off of his hip there, and the gauze would be coming off, and you can see all this stringy yellow stuff because that was infected. And then what happened is the doctor would clean this up, and he would put some new ointment there, new piece of gauze and tape, and then until the next week. Doctor would come in once a week, did that week in and week out. And then what happened is my father turned to be 40 years old. This was July 12, 1982. And at the age of 40, if you can imagine, he was not doing a whole lot. Right, he would come into the bedroom he would come into the kitchen about 2 hours a day, and my older sister, would spoon feed him because he couldn't take care of himself. And then he would go right back in bed, and he would be like turning from one side to the other. Right? In a short period of time, 3 months, right? By the time September came around, I just found this out, not very long ago, but my mom said we already knew he wasn't doing well, so, he asked me to just call the ambulance. So my mother called the ambulance, and when the ambulance came in, the 2 paramedics comes right up the stairs, and right in front of us, 5 kids, they go right in front, then they go right into the bedroom. By the time they got in there, they saw my dad, and they assessed him, and then they decided, they're like, listen, he's not doing well. And they told my mom, they're like, we're going to take him in. And they did. Right? So they put him on a stretcher, they roll him out, and as they're rolling him out, right, I looked at my mom and I said, where are they taking Dad? And then I asked again, I said, where are they taking him? And my mom never answered. And at that time, I was 9 years old, and that's when I decided, right? I quickly realized that being a good provider was not the most important thing. You see, my dad thought because, his job was to provide for his family, but guess what? When you don't have your health, you can't do that. I've been in this town now for 25 years, and guess what? When people lose their health, they don't know how to get it back. When people have their health, they don't know how to keep it. And when people have a win as it relates to their health, they don't know how to keep this going. Right? There's 1 or 3 things that you're going to end up being into one of those 3 categories. It's either you lose it, you're trying to get it back, or it's either you have it, you don't know how to keep it, or you have a win, but you don't know how to keep this thing going. Do you follow me? Right? So at the age of 9 years old, I realized that very quickly. So being in this town now for all those years, this is what I see day in and day out. When people lose it, they just don't know what needs to be done. And the reason for that is because I'm going to teach you that tonight. I'm glad you asked. Right? I'm going to teach you that it's all based on how people define health. And if you don't know how to define health, how do you define health? The decisions are all based on how you define your health. What health means to you. And that's the reason why we started this here over 20 years ago. And my wife is like, oh, yeah, you're good at it. You should do it. I'm like, well, what about you? You do it. No, she's like, no, you're better than me. You do it. So I want you to just understand here this thing called the paradigm of health. What does that mean? Paradigm means like, how do you define health? How do you define health? From that moment on, the base, the way that you define health, everything that you'll do from this point on, it's going to be based on how you define it. So if you define health, health based on I feel good, every decision you'll make is going to be based on that. Right? So you have high blood pressure, you go see the doctor, and then the doctor is going to give you what? He's going to give you a pill because we made a diagnosis. Based on the diagnosis, we'll give you a pill because that's what we do. So this is called healthcare system today. Just so you know, as a side note, it has nothing to do with your health. It has to do with managing your disease. How many of you here would like to have somebody manage your disease your whole life versus getting you well? Who wants that? Right? You know what? Nobody wants that. However, just about this entire country, that's what people do every day. Every single day, that's what people do. They're like, hey, I feel fine. And if I don't, I'm going to go see the doctor and he's going to give me a pill. And if he gives me a pill, then my symptoms going to be better. My number is going to look better. But yet, have I really taken care of the problem, though? Do people have headaches because they don't have enough aspirin in their brain? Do people have acid reflux because they don't have enough Tums in their belly? Right? Of course not. But yet, people do that every day. They're like, Dr. Jean-Guy, when I have the headaches, I take the pill and I feel better. I'm like, yeah. But did that really take care of the problem, though? Are we getting back to the cause, or you're just going after the effect? You see what I'm saying? Yeah, for sure. But I want you to understand that, because that's really important. That's the first paradigm of health. So if you define health as like not having any symptoms, you go to the doctor, you get the pill, or we're just going to, your gallbladder was a spare part. Your breasts, you don't need that. We can chop them off, right? Your appendix is not needed. None of those things are needed. We just cut the parts because they're not needed. It's no big deal. Do you follow me? So number two, this is paradigm number one. Paradigm number two is that those are the people that say, hey, you know what? I really don't like to do that stuff. So when I have some symptoms, then I'm just going to do things naturally. And that can be dangerous. Because what happens is you have a cold and then you go to the store and then you're like, well, I'm going to get some oil. I'm going to get some homeopathic. I'm going to get some vitamins, whatever that is. And then once that cold is done, then I'm just going to put that stuff away and I'm just going to wait until I have symptoms again. Right? So I'm 20 pounds overweight. I'm going to start exercising. I know I'm going on vacation. Then I go on vacation, put my Speedo on, and I look good. And then I come back and I just don't exercise again. Or there's some people, I know it's not you. It's certainly not this lady here, because I know she would never do that. But there's people that would say to me, Dr. Jean-Guy, you know what? My neck is killing me right now. And my last chiropractor was so good. He gave me this one crack 20 years ago. And I didn't need anybody after that, because he was so good. Right? So what happened? Now check this out. Are you ready? In this line right here, right? Those are people who are like, yeah, I don't take drugs. I don't want people to cut me. But yet, as it relates to your health, you define your health based on like not having symptoms. And if there is some symptoms, you don't want to take drugs. You're going to try to do things that are natural, but as soon as symptoms are gone, then you stop. Is it possible to have cancer with no symptom? Yes or no? The answer is yes. Is that possible? How many of you here know somebody that have had like, heart attack or a stroke and they didn't have any symptoms? Right? Of course, it happens all the time. Right? So how can you be thinking in your right mind, if you already know the answer, that because you feel fine, that you're fine? Right? You see what I'm saying? So we need to be changing the way we define health so you can be the best version of yourself that you can be. Do you follow me? So in this last paradigm of health right here, right, those are for the people that says, now check this out. If you look in the medical dictionary, it says that health is when you have 100% function, and then it goes on to say physically, mentally, socially, and spiritually, and not merely the absence of disease and infirmity. This is word for word. According to the World Health Organization, it says health is when you have 100% function, and then it goes on to say physically, mentally, socially, and spiritually, and not merely the absence of disease and infirmity. So what that means is you being healthy is when you are at your best 100%, and it has nothing to do with the symptoms that you have. Let me give you an example. If a person has a symptom, and if a person has a fever, are they healthy or sick? Right? Of course, that was a trick question. Of course. Because you were trained. You have a fever, I'm sick. And I would say to you tonight that you have a fever because you're healthy, because your body is doing exactly what it's supposed to do. If a person was to have diarrhea, and you're like, I see that with kids all the time. Kids come in, they're like, oh yeah, my mom, my dad didn't want me to come in yesterday because I was sick. I'm like, well, what happened? They're like, well, I had diarrhea. I'm like, well, you weren't sick, you were healthy. And then they look at me with big eyes and they're like, what does that mean? So because you have diarrhea, you just think that you have a sickness, right? I mean, this isn't like, if you have a virus, that's how your body get rid of the bad stuff. Wouldn't that be a good thing? Now, you might not like it. You might not like to have a fever 103, but it doesn't mean that it's not normal. It doesn't mean that you're not healthy. You see what I'm saying? So if you don't understand what health is, then the decision that you will make, right? You're going to be reaching out for your Tylenol because you're like, I have a fever. I got to bring the fever down. But yet the body is trying to bring the fever up to cook the bugs so you don't have to take the drugs. You see what I'm saying? But people don't know. You just don't know what you don't know. Or if you do know, then sometimes you get scared because people are like, well, if you don't do that, you're going to have a seizure. That's what people were told. They're like, parents call me all the time. They're like, Dr. Jean-Guy, little Johnny has a fever, 101. What do I do? Nothing. But Dr. Jean-Guy, another 30 minutes later, but he has a fever, 102. What do you do? Nothing. But Dr. Jean-Guy, when are you going to do something? I'm like, I don't know. Just like put a blanket around them. They're going to be fine. I know for some of you right now, it's like a big stretch. Because you're like, why would you be talking like that? When you do a review in the medical literature, it says that a high fever is like 105. How many of you have had 105 fever? I'm not telling you it doesn't happen. I'm just telling you it doesn't happen very often. People are scared to have like something like a seizure or those kind of things, but how many times does that really happen? And if you don't let the fever going up, then what happens is every time you take the pill, the Tylenol to bring the fever down, the body's trying to do the opposite, and you're like, yeah, this has been going on like this for a whole week. I'm like, well, of course, your body is trying to heal itself, and you're not going to let it happen. And then you're going to go see the real doctor, right? And what are they going to do? They're going to be like, well, you're sick. We're going to give you a pill, right? We're going to give you this antibiotic for your virus, which doesn't work anyway. And then every time you take the antibiotic, it takes 2 years for your gut to be restored again. 2 years. 2 years. It takes 2 years. 80% of your immune system is in your gut. It takes 2 years every time you take this one antibiotic. 2 years. When I have a young doctor coming to the office, it's so much easier to get them to talk, right? One of them came in. I'm taking x-rays of him, and I'm like, hey, do you have a lot of kids come to the, to the office? What do you do for them? He's like, yeah, Dr. Jean-Guy, when they come into the office and those family comes in, the kids, and they're sick, they always expect antibiotics. We'll just give it to them, even if we know it doesn't work. I want you to think about this for a minute. Who's responsible for your health? You are. What's the definition of health? You have to have 100% function, physically, mentally, socially, not merely the absence of disease and infirmity. So what that means is you having symptoms doesn't mean that you're not healthy. You have to understand that. Did you know that the Framingham Heart Study, you can look this up, 40 plus years ago, they've done the first heart study in the United States of America to find out why do people have heart disease. And what they found is when people had heart disease, their cholesterol was always high. From that moment on in time, right, they decided cholesterol was the bad guy. But did you know back in 1984, normal cholesterol was 334. That was normal. But yet today, for all of you here on your lab test, they would like to see that at less than 150. And do you know that if you have your cholesterol less than 150, your body cannot make hormones and then you just go cuckoo, right? How many of you want to sign up for that program? You're like, hey, that sounds really good. Let's just keep your hormones really low. And then you have this, anxiety. You have this thing called fear. You have this thing called depression. And that's okay. We have a pill for that, right? And then you won't be able to make hormones, things like progesterone or estrogen or testosterone or DHEA. Do you know how many people today in this country, men and women, they're not like they have problems, they have hormonal problems? Do you understand that? Who's responsible for your health? You are, right? But if you're responsible for your health, then you need to understand a little bit better about how your body works. Does that make sense? Okay, so I'm about to tell you something that is important. Everything else was not important so far. Ready? So here we get into this paradigm of health, right? It's like, okay, I want to be healthy. What do I need to do? I'm going to tell you. Number one is you got to think well, right? You got to think well. What's happening upstairs here, this is kind of interesting. There's like some amazing, the science behind thinking well is amazing. We've known for a long time that when you don't think well, or if you have like your thoughts right? Your brain, your mind is like the battle is right there. Your thoughts will determine how your body is doing. You can create disease with your body, and you can also create health with your body, which is truly amazing. And most people don't know that. So you have to be able to be around people that you feel safe around them, that you can love them, they can love you back, reading a good book. But this mindset here is really important. And most people, they don't really fully understand that. Right? In the Bible, it says in the book of Proverbs that there's life and death in the power of the tongue. And I hear people all the time, every day they come in, they're like, oh yeah, that's my fibromyalgia. That's my blood pressure. That's my disease. You know, that's my pain. It's mine. It's mine. It's mine. I'm like, well, if it's yours, it's going to be yours for sure. It's never going to go away. Your mind is important. How do you speak to yourself? I ask people, I'm like, do you think you can get better? There's some people that were like straight out, they'd be like, oh no, I'm never going to get better because it's mine. It's my fibromyalgia. It's mine. It's mine. It's mine. It's my chronic fatigue. It's mine. It's mine. It's theirs. It's my depression. It's my fear. It's my anxiety. It's mine. I would like to tell you tonight that you have to change that. And you're never going to be able to get your health back if you don't change how you talk to yourself. That's so important. I mean, you don't have to. I'm just telling you that can make a huge difference in your life. Number 2. Now remember the stats. 53 million people in 2022, they've been diagnosed with some kind of mental health diagnosis. Whether it's like fear, anxiety, depression, like just name it. You know, I mean, there's like diagnosis for mental health. Like, I mean, the book is full, right? The book is full. And then number 2 here is you have to eat well. That's number 2. So you got to think well first, then you got to eat well. Now, did you know that if you go look up on Dr. Google, the food pyramid in the United States of America, the food pyramid in the United States of America, it's called the SAD diet, the Standard American Diet. When you do the Standard American Diet, for sure, you're going to die early. For sure. If you follow what they tell you to eat, for sure, you're going to die early. God forbid, just don't eat any fat, right? If you eat fat, you know, I mean, you're going to be fat. Did you know that if you eat fat, you're going to lose fat? I mean, that's that's mind-boggling. People cannot understand that. You eat fat, you lose fat. How's that work? Not eating at the fast food restaurant, but if you eat good fat, you're going to lose fat. That's how your body works. So when you eat the Standard American Diet and you eat cake, cookies, candies, ice cream, bread, rice, and pasta every day, you have no chance. Right? You have no chance. You get up in the morning, you have your glass of orange juice, and then you have your cereal, and then you have your milk. You have no chance. Zero. But yet people do that every day. People are like, well, Dr. Jean-Guy, what about my oatmeal that I cook in like 3 seconds? Can I just have that? I mean, they told me it was good for my cholesterol. Like, yeah, just keep having it. You're taking your cholesterol pill and then you eat your oatmeal. How's that working out for you? Do you see how it makes no sense? So we're supposed to be on this best diet. We have the Standard American Diet, but yet we're the sickest in the world. The sickest in the world. Just think about this for a minute. Even if they were to give all the drugs for free and all the surgery for free, we'd be living in the sickest world, right, of all the industrialized world. Think about that for a minute. Infant mortality, we're just at the bottom. 75% of this country is considered to be overweight. Over 35% is like obese. I was just at a spine conference this past weekend in Atlanta, Georgia. They were reviewing study from Cairo, Egypt, and they were looking at the people that they're taking to do the study, and they could not find enough people that were overweight to put them into the study because they were looking for them. In the United States of America, we have no problem finding that. No problem, zero. Did you know that every extra pound of fat that a person has on their body is like 4 pounds on their joints? 4 pounds. Think about that for a minute. So when people have a knee problem, you don't have a knee problem, you have an inflammation problem, and you have inflammation because you eat cake, cookies, candies, ice cream, bread, rice, pasta. That's just how it works. It's pretty simple. Now I'm giving you all my tricks. I'm going to run myself out of a job here, you know, when you know everything you need to do. Right? So here we go. You got to think well, you got to move well, and then you got to eat well. And then the last one here, it says you got to be moving well. Right? Moving well is if you drive to the drive-through and then you go home and you sit and you watch a football game, that's not exercising. Just so you know, moving your eyes doesn't count, right? Moving your eyes does not count. Did you know that a Nobel Prize winner back in the 80s found that 90% of your brain nutrition has to do with proper function of your joints? 2 weeks ago, last week, I was in Atlanta, Georgia for a spinal, conference, spinal rehab conference on the lumbar spine. The week before that, I went to a conference on longevity because this is kind of, somehow I'm getting older, so I'm interested in that, right? And then the guy is 70 years old and he's teaching there and he's going over the 8 things that has the greatest impact on people that gets to live to be 100. Do you know the one? I'm going to tell you the one. Do you want to know the one? The one that has the greatest impact on a person that gets to live to be 100 years old. Did you know what that one thing was? 46% was because of moving. 46%. It's a pretty big number, would you say? Out of 8. You don't know the other 7. I'll teach that in March. I won't tell you tonight. Right? In March, we're going to have a class on longevity. I'll go over the other 7. But tonight, I'll give you the one. The one, it's moving. 90% of brain nutrition has to do with moving, your joints functioning properly. So if you don't move, your brain's going to die. It's no big deal. Do you know how many people today in this country have this early dementia, Alzheimer, Parkinson, right? You guys know people with that? Of course, they're everywhere. One of the number one reason why people losing their cuckoo there, besides this cholesterol thing going real low, their fat going real low, I'm going to tell you the number 2. Are you ready? The number 2 reason is when people take those cholinergic medication. Do you know what those are? Anything that has to do with people that have allergies. So when you take Benadryl, head cold stuff, and you go to the pharmacy and you take over-the-counter stuff, this is the number 2 reason why people lose their mind. What do you think about that? But that's okay. It's not a big deal. I won't be able to get in that rabbit hole right now, but do you understand how important that is to know a little bit more about what you need to do for you to be the best version that you can be? Right? So you got to think well, move well, eat well. Yes, that makes sense so far? Yes or yes? The answer was yes. And last but not least, so if health is when you have 100% function, what controls all the function in your body? Talks to me. Who's going to talk to me? Right? No, you're getting close. Right? There's one thing that controls everything else in your body is this guy right here. This is your brain. Your brain is in charge of controlling 70 trillion cells in your body. How many? 70 trillion cells are controlled by your brain and nervous system. 70 trillion cells. For your heart to beat, your lungs to breathe, your stomach to digest food, the information has to go from your brain, through your spine, out the nerves, to every organ, tissue, cells in your body. Did you know that you go from 100%, we're going to talk about symptoms now, you go from 100% function all the way down to 60. You have to have at least 40% of sickness, death, or disease in your body before you start having symptoms. I'm going to say this again. Did you know that you have to have at least 40% of sickness, death, or disease before you start having symptoms? So why in the world would you be gauging your health based on having symptoms or not? But yeah, that's what most people do. Does that make sense? So 40% of sickness, death, and disease before you start having symptoms. So you don't want to wait until you have symptoms. You want to get going here. You want to make sure things are functioning properly. This area right here, the top of your neck, let me tell you a little bit about the top of your neck. The top 2 bone there, that Nobel Prize winner, this is what he found, that 90% of brain nutrition has to do with proper motion of your joint, especially the top 2 joints in your neck. It's called your atlas and axis. Those are the top 2 bones. This lady came in. She was a teenager. Some of you heard that story before. Her name is Victoria. When she came in, she had clinical depression, but yet I did not know that. She didn't tell me that. Because she came in for headaches, which there's a lot of people come in for headaches. We do great with the headaches. However, she was coming in for headaches. She never told me about the depression. And come to find out, after we adjusted her for, we found out that she had some damage to her spine and nervous system right here. And now we're 4 to 6 weeks into working at correcting this. And then the mother comes in and she started crying. And when people cry in front of me in the middle of everybody, I always think I'm in trouble. I don't know why, but I thought I was in trouble. So I took her in the back room and I was inquiring, what's the reason for that? And she says to me, she's like, listen, my daughter, when she came in, we never told you that. Not only she had headaches, but she was also diagnosed with clinical depression. And since you started to adjust her, now she comes into the house. Before, she'd go right into a bedroom, never talk to us. And now she started coming to the house. She comes and talks to us, which never happened since she's been diagnosed. You see this area right now, this area right here in the top of your neck? If your head is not on straight, quote unquote, if your head is not on straight, you're never going to be able to think right. Your brain's never going to be able to get the nutrition that it needs, because this area here, it controls your balance. It controls your sinuses, right? People can have headaches, but on top of that, they can have problems with their balance. They can have issues with focus, concentration, attention, all coming from this area, because that's what it controls, which is kind of important. Would you agree with that? Right, number 2 here, this area of your back, your spine and nervous system, this has to do with your digestive system. Do you know how many people today in this country that have problems with their digestive system? That people are bloated all the time, or they have indigestion, or they have heartburn? It happens all the time. Right? Probably half the people that come to the office, they have some digestive issues, but yet they're either not going to tell me, or they're going to tell me after. And they're going to be like, hey, Dr. Jean-Guy, I used to have like heartburn, but now it's gone. I'm like, interesting. This lady came in. This was early on in practice, within my first 5 years. Her name was Kim. Saturday morning, 10 o'clock. She's like, hey, can you adjust me right here? And I'm like, well, who's the doctor? Is that me or you? And she says, well, Dr. Jean-Guy, I'm sorry. I just moved here from Canada, and every time I have heartburn, I get adjusted right here, and it's gone. Because what happened is this area of your spine and nervous system is in charge of controlling the entire digestive system. Do you follow me? Right? People will be like, hey, I was so embarrassed, never told you that I had a problem with my bowel movement. Now I've been getting adjusted, and now I poop every day. I'm like, interesting. Now you're not full of it anymore. Right? Now the latest, which is really like this past year, I've had 2 people. Of course, one of them never told me, but the other one, she had the desire to tell me, I guess, after a while. And she comes in and she's like, well, not only have back pain, but I just pee my pants, and I'm only 40-some years old. That's pretty embarrassing when people pee their pants, would you say? Some of you, maybe you've had that, and you don't need to tell me, but I hear this like on a regular basis. And after we started working on our lower spine right here, people can have back pain, but they can also have those nerves. Where do they go? They go to your bladder. They go to your large intestine. They go to the ovaries, to the prostate. Do you follow me? So what would that mean to you? This lady, Ann, she was older. She was like, no offense, here in her 60s or something. I'm getting older too. And, she never told me. We got to the reevaluation. She's like, oh, by the way, I was embarrassed to tell you, but now I don't pee my pants anymore. Now, when you're 20, you don't really care because it probably doesn't happen to you. Right? But just imagine you're 40 years old and you're just peeing your pants. How would that feel? Probably you wouldn't like it. Right? So I tell people, I'm like, listen, you got to think well, you got to move well, you got to eat well, and things got to function properly. Your spine and nervous system is the master controller system in your body, the master controller system. This young lady here earlier, and she's not the only one, she says, hey, what controls everything in your body? She's like, your heart. I'm like, no. The first system embryologically that is formed into your body the way God made you, right, is your spine and nervous system. And from your spine and nervous system, your body will develop all the other system, and they're all controlled by your brain and nervous system. How about that? Yes or yes? Right? Absolutely. 100%. So I want you to understand that if you truly want to have health, you have to be changed. You have to be changing the way you think about health and what that means to you. And my goal for you tonight, right? When I do those dinner, that's really, I just want to be changing the way you think, and you might not like it, but I just want you to understand if you don't change the way you think, you're never going to be able to have what you really want. What you really want, I don't really know, because I tell people, I'm like, when it comes down to your health, you can do whatever you want because that's your health. But just imagine for a minute here tonight that you don't do anything about the problems you have and you continue to do what you're doing, what you've always done. What's going to be the results? It's going to be the same, right? The definition of insanity is to do something over and over again, expecting something different. That's it. That's what being insane is. You just keep doing the same thing. Right? I had this young lady sitting right next to me this weekend, And she's like, well, Dr. Jean-Guy, I take this antidepressant medication. And she's like, I don't think it's working. I'm like, so are you still taking them? She's like, yeah. I'm like, okay. I know right now you're thinking, you're like, that's kind of interesting. But we all have done it at some point in time. You just do things and it just doesn't work. You just keep doing them. If we don't change the way we think, the outcome is never going to be better. So when it comes down to your health, you can do whatever you want because that's yours. But if you don't do anything about it, it's going to continue to get worse for sure. However, you have a chance, an opportunity to do something that is different. And if you do something that is different, then the outcome is going to be different. And what that means to you, it could be like, hey, you can get on your knees and you can play with your grandkids. Some of you might be like, hey, I just want to be in the bleacher and I want to be able to sit there for a couple hours and not to be in pain all the time. Right? Some people are like, Dr. Jean-Guy, I just want to go on a trip with my husband, my wife, and I don't feel like I can do that because I'm waiting for the next doctor's appointment constantly. Think about that for a minute. Right? And that's the reason why I tell people, I'm like, well, some of you here, you already do this, but if you don't, I want to offer to you this wellness breakthrough evaluation of like being evaluated to truly, to know, to have a starting point, to see how the foundation is. And when we do our wellness breakthrough evaluation, when we do this chiropractic evaluation, your spine and nervous system, the reason why we do this is because that is the foundation. If there's 70 trillion cells in your body and they're all controlled and coordinated by your spine, and then your spine is not healthy, guess what? Everything else that you do after that, people are like, well, Dr. Jean-Guy, I eat well. I'm like, well, good for you. But if you eat well, but your brain is not capable of sending the right message at the right time to your stomach to produce digestive enzyme, even if you eat organic food, you still won't be able to digest it. Do you understand that? Right? You won't. Even if you're like, well, Dr. Jean-Guy, I think, well, I read all the best book. I'm like, yeah, but if your head is not on straight and it's crushing your, your spine and nervous system right up there, right, where that main connection between the brain and the rest of the body is coming through. Just talk to Christopher Reeves. Well, you won't talk to him because he's no longer with us, just so you know. Because what happened is just like this, in no time. Right? In no time. What happened to Christopher Reeves, the old Superman? In no time, right? Just like that, the following day, within 24 hours, he was in a wheelchair. And the reason for that is because he had damage in his spine and nervous system right here where the top bone is. And as soon as that happened, from this moment on, within like a short period of time, 3 years, when that life energy doesn't make it through, guess what happened? He didn't have any pain, right? That's why he had like a pacemaker for his heart to beat. He had a respirator for him to be able to breathe. And somebody would be pushing on his colon every single day for him to have a bowel movement. But yet, the guy did not have any pain whatsoever. Zero. None. Think about that for a minute. So when we do a wellness breakthrough evaluation, what we do is we do multiple things. Number one is we're going to do this very in-depth consultation of asking you a bunch of questions, what your concerns are, what your health concerns are, because that's important. Every single person is different. And then to be able to evaluate you properly, to know what your problems are, what your concerns are, right? When we do this chiropractic evaluation, then we'll take pictures of your posture. Why are we going to do that? Because your posture is a window to your spine and nervous system. Did you know that kids comes into this world? Baby comes into this world like this, and then you're also going to leave like this. So if you're like 50 years old and you're walking like this, right, this is not good. Do you understand that? Did you know that having a bad spine and nervous system, it's called adult spine deformity, is worse than having rheumatoid arthritis? It's worse than having cancer. It's worse than having heart disease. Because it is. And then last but not least is what we're going to do is we're going to take some pictures of your spine. We're going to lift the hood and we're going to go on the inside and we're going to see what's happening there. We're going to see if you have any damage, how long the damage been there for, how much damage there is, and can that be corrected or not. And once we do all of this, then we're going to know exactly what needs to be done next. We're going to be able to see what your problems are, if you have any, even if you feel fine. How long has it been there for, right? Can we help you with that? And then having a game plan to say, hey, what are we going to do about it? If you were to go to the emergency right now, urgent care, or you go to the emergency, how much do you think they charge you if they were to do a full set of x-rays? How much? Right? $200? What else? Plus the visit. Yeah, it's more like $1,000. Maybe you should you go to the emergency, have them give you the bill, you see what happened. Okay? If you haven't been there, just have them take one set of x-rays, just see what happened. It will not be any less than $1,000 just for the x-rays. Here we go, $1,800. I want to go take x-rays at the emergency. So this lady says $1,800. The bottom line is, right, if it was needed, would that be okay? The answer is yes, for sure. And I tell people, when people come to our office, we charge $320 to do that, which is really, at the end of the day, for the information you'll get out of it, it's really nothing. Well, let just me tell you what happened here. Right, September 14, 1982, when my father left that day, right, I was 9 years old, my brother was 8 years old, my other brother was 7 years old, my sister was they were both teenagers, my mom was 35, right, she's right there in the corner. After I asked her the question twice, where are they taking him, she never answered, and we're all here, we're all in line here, and we're watching what's happening, we're just watching it. And when my father left that day, right, he's on the stretcher, those two paramedics, they're just pushing him out the door. Right, and guess what happened? Right, I never saw my dad again. My father had a heart attack on his way to the hospital. And I always tell people, I'm like, listen, if my father would have been sitting right here tonight, right here, right there, 10 years prior to him dying, right, the chances are he would have seen me getting married. He would have seen his grandkids playing sports. He would have seen me graduating, but you know what? That never happened. And the reason why that never happened is because he did not know any better. He didn't know any better. He didn't really know what health was all about. Just like millions of people in this country, people don't know what they don't know. And that's the reason why, right, if you've never had your wellness breakthrough evaluation, you really have nothing to lose, right? When people schedule their adjustment, when I come here and I do this, this workshop, and I tell people, I'm like, listen, you can have your evaluation for $69. $69, you can have all of that to have a report, and then having the understanding, having the know-how, having the knowledge and the information, so then you know. Because people don't know what they don't know. Do you follow me? Right? That's the reason why we do this. So I want this to be clear, that's why this is so important to me, because I've seen my father, but being in this town for 25 years, I've seen thousands of people. And the story is being repeated, right, over and over again. And you know what people would say to me? Now listen to me for a minute. You're sitting back right now and you're like, hey, your dad's story, that's pretty sad. I'm like, no, it's not. The reason why I'm here in front of you, it's because of my father. My father was my greatest blessing. And what I want to say to you tonight is, guess what? I wouldn't be in front of you if this would not have happened to my dad. And people would say to me in 25 years, hundreds of times, people would say, well, aren't you worried that the same thing going to happen to you? And guess what my answer is? If I make the same decision as my father, the outcome is going to be the same. And I want to leave you here on this tonight before you get the food. Because some of you, you're sitting back and you're thinking, you're like, well, everybody's got bad genes in my family. It's running in my family. Right? People have all heart disease, and they have fibromyalgia, and they have rheumatoid arthritis, and they have cancer. Right? And I always tell people, I'm like, listen, the only thing that runs in people's family is silliness. If you make the same decision, the outcome is going to be the same. Do you understand that? There's this whole science out there. It's called epigenetics. And what that means is, that means above the gene, your genes are just like a library of books, and you decide which one you're going to be pulling them off the shelf. You make that decision based on how you treat yourself. How do we know that? Because they take twins that have the exact same genes. The exact same genes. They put them in a different environment, and guess what? One of them will develop chronic illnesses and the other one will not. Will be perfectly healthy and live a long life with no diseases, zero. So if you're sitting back in your seat right now and you're like, oh, everybody has this in my family, I'm going to have it. I'm like, well, if you say that, of course it's going to happen. Because remember, there's life and death in the power of the tongue. It's going to happen to you for sure. But it doesn't have to be. I made different decision than my father. Do you understand that? And you can make different decisions for yourself and your family if you choose to. And that's the reason why, if you decide that you have this wellness breakthrough evaluation tonight, right? The reason why we do this, and I say, hey, you know what? I mean, you really have nothing to lose. $69, then you'll be evaluated, and then you'll know what's going on. How is your foundation? You follow me? Now, some of you here, you've already done that. You're already engaged into this process. I want you to be asking yourself, now I'm circling back to where I started tonight. I want you to be asking yourself, am I doing everything I'm supposed to be doing here? And which area that I'm not working at right now that I should be working more at? Do you understand that? Do you also understand that in the next 6 weeks right now, you're going to go to about 27 parties and it's going to get ugly? Yes? Maybe you should buy duct tape. Maybe you should put it over your lips. Maybe you should be eating before you go to those parties so you don't have to eat there. Remember that you have the choice. You don't have to be a victim. You're making that choice. Before you leave for that party, you're making the choice. Do you see what I'm saying? I'm giving you strategy. Like tonight, we're going to bring some bread and we're going to be watching. I just want to see who's going to be failing the test. Okay? It's fresh. I mean, it's, I'm going to really test you. It's really fresh. So here's how you do this. This is on your table. I need to explain it. They told me to make sure I explain this to you because there's always confusion. Pull this out. That's right underneath the flowers. There's a QR code here because you might be thinking to yourself, you're like, how am I going to do this if I'm going to say I schedule an appointment? How do I do this? I want to tell you how we're going to do it. Are you ready? A bunch of young people here. There's maybe like 2 people that are in my clan. Everybody else looks like they're 12, so I'm sure you know how to use your phone. So you scan this QR code, and this QR code is going to take you to this thing called, right? It's going to have you pick between 2 offices. We have 2 offices. Gilead is one of them, and then we have another one on the other side of town. So you have to pick the office. I was told on my little cheat sheet here that Dr. Jean-Guy doesn't work out of this office. So if you pick Gilead, you will not see me. And that's not really important. You need this way more than you need Dr. Jean-Guy, just so you know. Side notes. Number 2 is then it's going to ask you to put your information in. So then you put your name, you put your information, and then the next thing that's going to happen is it's going to ask you to pick a time. It doesn't matter the time that you pick. If you're not sure, it doesn't matter. Just pick a time. And then what's going to happen is going to prompt you. It's going to take you to the last screen, and the last screen is going to be the payment screen, and then you can just make your payment. It doesn't matter if you put your name or the name of the person next to you, one of your kids. Anybody can take advantage of this offer tonight. Understood? Anybody. But you have to follow the step. Here's the step. You scan the QR code. Number 1, you pick the office, you put your name, you pick the time, and then it will take you to the payment screen. Understood? Who did not understand what I just told them? I'm going to get in trouble if you guys, I got the notes right here and they get really mad at me, okay? Everybody gets this? Yes? So here's what's going to happen now. I'm going to tell you this last story I want to tell you. And then you're going to go get some food. I think we're going to go right out this door, right, Pat? Out this door. And I'm going to be calling your name by table. You guys are going to go get the food. You're going to circle back into here. But I want to leave you with this story, and then I'll answer a couple questions before I go home. How many of you hear the story about the bison and the cows? Bison and the cows. Nobody knows the bison and the cow story, right? This young lady here, she knows, so she can't say anything. She can't tell everybody. I'm going to tell you the story about the bison and the cow. Are you ready? You know, cows, when there's a storm, when they see the storm coming, the cows are going like that. They're trying to avoid it, right? They're like, hey, just going to wait as long as I can because I don't want to get through the storm. And you know what the bison does? When the bison sees the storm, right, he runs right through it. I'm going to tell you right now that you have the opportunity to either be the cow or you can be the bison because you know what? One way or the other, you're going to have to get through it. And I'm going to also tell you that working on your health, when you work on it and you don't really have problems, it's much more enjoyable than when you do have a big problem. When a person has stage 4 cancer and they have to work through their problem, do you think that it's fun? When people have like big time problems, who are they focusing on? Themselves or the people around them? Yeah, themselves for sure, 100%. So what I say to you tonight is that, hey, you know what? Just be the bison. Don't be the cow. Because you know what? It doesn't matter if you just keep backing up. It's going to happen. There's no such thing as being still as it relates to your health. If you don't do anything, 100% you're getting worse every day. Every single day you're going backwards. Just be the bison. I'm going to pray for your food, and then I'll see who passed the test. Ready? This lady's laughing here. Father, we just want to say thank you for tonight, for all the people that are here in this room tonight, Lord. I just pray that all those seeds, if they weren't from you, that they can just pass right by their mind. But if they were from you, that they can just start growing right in their mind and hearts as it relates to their health. I just pray, Lord, that you just pour your blessing over each and everyone in this room here tonight, that you give all of us more wisdom as it relates to our health. And I just pray that you bless the people that have made this food here tonight. And I pray that you bless the people here that are about to eat this food in Jesus' name. Okay, so here's what's going to happen. Table 1 and 2. This is table 1 and 2. We're going to follow Pat here. She's in pink. Follow this lady right here. She looks like she's 12. Follow those two tables here. I want you to do this right now. And then the rest of you here, you have an opportunity. Maybe you don't want to. But if you have some questions, I'm going to take a few questions. As people are starting to eat, you can go ahead and ask me some question. If you don't have any question, I'm just going home right now. Yeah, this young lady here, she says, what's the science? Those cholinergic drugs, what they do is they fry the brain. They cause inflammation in the brain. So they're called cholinergic drugs. They cause inflammation in the brain. Anything that causes brain inflammation will destroy your brain. So, yes, sir. Yes, sir. Well, it's a 5-year plan to do what? Okay. Yeah. Wow. You go out with this guy? Oh, well, he was a smart man. Did the right choice. So here's what I want to say to you. Every person that I've seen getting those shots, they usually never come out of it. Because we're not getting to the cause, right? So the question is, you have allergies, whatever they are, or congestion. So we want to find out what's causing that, yes? Okay, so you need to find out what's causing it. So who is they and what are those things are? And then the question is, can that be reversed? And the answer is yes. If you're around the right people. We have people here that are nutritionists. I'm one of them, and we have another one that we can help you out with that. Yeah. Okay, those two tables right here, you can go. Those guys are just like, they're ready. They all came back already. They have no bread. I mean, this lady's got one piece here. Very good. She's like, Dr. Jean-Guy, and I'm not buying this. Okay, you two tables. Okay, I'm going to answer some more question. Go ahead. And then I'll come to Laura. Go ahead. I'll answer your question first, and I'll answer Laura's question. Yeah. So, yeah, of course, you can see a chiropractor near you. There's 60,000 chiropractors in the United States. However, chiropractors, just like physician, they all have different specialties, so to speak, right? So let me explain this to you a little bit. So in the world of chiropractic, when you graduate from chiropractic school, then people will decide to, let's say they just want to adjust kids. Some people, they just want to take care of pregnant moms. Some people want to take care of families. Some people want to take care of people that are in pain, right? So there's different training. Some people specialize in neurology. Some people specialize in spinal biomechanics. So there's a lot of different specialty within the world of chiropractic. So then you have to decide, when I make a referral myself, I call the chiropractor. So if a person is looking for what we do, right, our specialty at our office is I specialize in spinal biomechanics, right? So this is our specialty, and we look at the body from a holistic point of view. So sometimes depending of the specialty of the chiropractor, they have different, they do things differently. Does that make sense? Yeah. I'm going to answer Laura's question, and I come to your question, young lady. Go ahead, Laura. Yeah. So what is the question? Well, if 1984 was 334, in my book, my personal cholesterol has been at 239 my whole life. Yeah, the total cholesterol. And really, it doesn't matter. At the end of the day, it doesn't matter if a person is healthy, your cholesterol is going to be wherever it needs to be. What you need to be keeping your eyes on is there's markers when people, from the medical doctor point of view, the concern is for heart disease. So the markers that are more important on a blood test would be something like high sensitivity, C-reactive protein, CRP, homocysteine, LPA, fibrinogen. Those are the things that if a person is concerned with heart condition, to ask the doctor to run those tests. So the total cholesterol, the HDL, LDL doesn't mean a whole lot. But I will tell you, when your triglycerides are high, the triglyceride means it's the crapometer. The more crap you eat, the more your triglycerides is going to be up. 100% of the time. A person can do a 21-day cleanse and you can see those numbers coming down by hundreds in 20 days, right? It doesn't take years. It takes a few weeks and it will change. 100%. You guys need to eat. Those guys are back already. Let's go. Go get your food. Yes, dear. She had a question. Well, I'm not going to ignore her for sure, even if you're eating. Go ahead. Yes, I have a good friend in Chelsea. He specializes in that. I have a good friend in Chelsea, Michigan, that specializes in that. And yes, positive outcome. It's a secret. I won't tell you. You'll have to pay me.
Because they just went the whole way to Philadelphia for my granddaughter, and they got no information.
Yep. This guy, that's what he
My
does.
daughter has researched and researched. Maybe
Yeah.
this is-
Dr. Kaiser.
If I can chime in,
Okay. KIASER, I'm assuming.
Yeah. His phone number is 734 707 5105. Trust him with my life. He can handle that. No problem.
What is his first name? That's all right.
Nathan. Nate.
Nate, okay.
Yeah.
Thank you. Maybe this is why I'm supposed to be. I need myself fixed, but they need it more.
Everybody needs to be fixed.
Thank you.
I used to have a heart rate of 150 and it would drop to like 50. And I would
Okay, any more questions? Sharon, do you have any questions before I go?
start exercising and eating more.
The one that you gave me, the last
My head
medicine you gave me.
I don't give people medicine.
Well, I'm sorry.
I died 100 times. that I was over you. How I was mistaken. Why did I bump into you and start this chain reaction? I felt a building up inside. When suddenly, oh, what's more that I can bear? More than I can bear. When I saw you walking down the road with someone, I couldn't believe it, it was true. Oh, it was true. I find it hard to sleep at night. This jealousy is burning bright. Visions of somebody else torments me to distraction. Oh, yeah. I think of him making love to you. It's more, it was more than I can bear. It was more than I can bear. Oh, yeah, girl. Walking down the road with someone, I can't believe that it was true. It was true. When I saw you walking down the road with someone, I couldn't believe it was true. It was true. When I saw you walking down the road with someone, I couldn't believe it was true. It was true. Yeah.
For your love, when I think about those nights in Montreal, I get the sweetest thoughts of you and me. Memories of love above the city lights. Ooh, I try so hard to take it, but oh Lord, my heart would make it. I just wanna stop and say what I feel about you, babe. I just wanna stop and never wanna leave without you, babe. I just gotta stop for your love. the world must serve. I get the saddest thoughts for you and me. Memories of life in times of song unknown. I try hard to forget it, but oh Lord, my heart would make it. I just wanna stop and say what I feel about you, babe. I just wanna stop and never wanna leave without you, babe. I just gotta stop for your love.
One of these nights, one of these crazy old nights, we're gonna find out, pretty mama, what turns on your lights. The full moon is calling, the fever is high, and the wicked wind whispers and moans. You got your demons, got your desires, well, I got a few of my own.
Ooh, someone to be kind to in between the dark and the light. Oh, you coming right behind you. Swear I'm gonna find you one of these nights.
One of these dreams, one of these lost and lonely dreams, we're gonna find one, one that really screams. I've been searching for the daughter of the devil himself. I've been searching for an angel in white. I've been waiting for a woman who's a little of both. I can feel her, but she's nowhere in sight.
Ooh, loneliness will blind you in between the wrong and the right. Oh, coming right behind you. Swear I'm gonna find you one of these nights. One of these nights, in between the dark and the light, I'm coming right behind you. Swear I'm gonna find you one of these nights. One of these nights. Oh, oh, oh. One of these nights. Ooh. One of these nights. Oh, oh, oh. One of these nights. We both lie silently still in the dead of the night. Although we both lie closer together with the miles apart inside. Was it something I said or something I did? Did my words don't come out right? Though I try not to hurt you, though I try. but I guess that's what they say. Every rose has its thorn, just like every night has its dawn, just like every cowboy sings his sad, sad song. Every rose has its thorn. I listen to a favorite song playing on the radio. The DJ say he loves a game of easy come, easy go. But I wonder, does he know? Has he ever felt like this? And I know that you'll be here right now if I can let you know. Somehow, I guess every rose has its thorn, just like every night has its dawn, just like every cowboy sings his sad, sad song. Every rose has its thorn. Though it's been a while now, I can still feel so much pain. Like a knife that cuts you, the wound heals, but the scar remains. Yeah, yeah. I know I could have saved your love that night if I known just what to say. Instead of making love, we both made separate ways. And now I hear you find somebody new, and that I never meant that much to you. To hear that tears me deep inside, and to see you cuts me like a knife. I guess every rose has its thorn, every rose has its thorn, just like every night has its dawn, every cowboy sings his sad, sad song. Every rose has its thorn, every rose has its thorn, just like every night has its dawn, just like every cowboy sings his sad, sad song. Every rose has its thorn.
Why do birds suddenly appear every time you are near? Just like me, they long to be close to you. Why do stars fall down from the sky every time you walk by? Just like me, they long to be close to you. On the day that you were born, angels got together and decided to create a dream come true. So they sprinkle moon dust in your hair, golden starlight in your eyes of blue. That is why all the girls in town follow you, all around, just like me. They long to be close to you. On the day that you were born, the angels got together and decided to create a dream come true. So they sprinkled moon dust in your hair, golden starlight in your eyes of blue. That is why all the boys in town follow you, all around, just like me. They long to be close to you, just like me. They long to be close to you. Close to you. Close to you.